Hey everybody, I am Ryan Hamner, and this is Dr. Christina Garoppo. Okay, so today we're going to be talking about
sex.
We're
Today
going to
we're going to talk
sex.
about sex. Sex.
We're
Today
going to talk
we're going
about
to talk
sex.
about sex.
And we're going to be specifically talking about a lot of questions that women have for men who've been through cancer and cancer treatment. So the first one we're going to talk about is, well, a question that I've been asked is, does it even work? Which I always respond with something like, well, hold this.
Something sarcastic.
Yeah, sure. So I'm going to let Dr. Garoppo talk about, is there any reason why it shouldn't work or wouldn't work? So it wouldn't work. So
Okay, so I mean, other than something like prostate cancer, which could directly affect an erection, the thing that most affects the thing that would most affect someone that is going through cancer treatments is not actually the treatment itself, but the stress that's associated with the cancer treatment. Stress will shunt blood away from the center of the body, and an erection is entirely blood dependent. For all of you guys that are out there trying to get testosterone, and your levels are fine, you simply don't need to worry about that. Unless you are very old, giving you testosterone is not something that's going to dramatically affect an erection. What affects an erection is actually blood flow. When you're under distress, your body thinks that it needs to fight something or run away. And so it will shunt blood away from the center of your body, away from your digestive system and your genitals, and it will move it to the muscles and the systems that will help you either fight something or run away from it. And so what I would tell you is, if you're having an issue with an erection, you need to relax. Try to calm down.
Okay, so that sounds good. So the other thing this is a really good one that I've been asked before is there any stuff in there? So
is there any stuff?
So I'll be real clear. There's a lot of men who've been through cancer and cancer treatment. They might not be able to, make babies, but there's nobody's firing dust. So, yes, there is stuff.
There is stuff.
There's stuff in there.
There is stuff. There may not be sperm, because you know that cancer treatments it specifically targets rapidly dividing cells. That's how it targets the cancer, and not, say, your arm, because these cells are not rapidly dividing. Sperm cells are rapidly dividing. That's why it will target sperm cells. Now, theoretically, you should be able to protect the genitals from some of these treatments. We're not necessarily finding that is the case. But when it comes to ejaculation, sex, we're good. Everything's good.
Yes, so I've heard people say, how do you know you can't have kids? Like, how do you really know you can't have kids? Well, now I'm not going to say that this was me personally, all right? This isn't anybody I know, but this definitely wasn't me personally. But I do know of a person that had to, do his thing into a cup at the house and drive probably about 20 minutes, really fast in a car, and take it to the lab. Now, the first lab was the wrong lab, and they called out his name to the waiting room about his sperm sample. Then he had to go to but it was really a lack of sperm sample. It was not a sperm sample. And he had to go to another lab.
Leave it to medical professionals.
So this guy, I know him very well, found out that there were no sperm. There was zero sperm. So a lot of people, if they're concerned, they will get checked, and they'll know that they don't have any swimmers. So that's pretty much all I have to say about
that. It's the case, but it doesn't mean you can't have fun. It doesn't mean that you can't enjoy a healthy sexual relationship with your partner.
Yeah, without the dust.
Without just no babies.